My name is Roa Rallapalli. I am from California. San Ramon is where I live. I came here especially to Hyderabad to get whole mouth restoration done from Dr. Motiwala and his great team. I wrote down some notes so that I say everything that I wanted to say without forgetting anything. So you don't mind, I'll dot to the screen once in a while. I had known for long that I needed a major dental treatment right from childhood. I had some dental issues, and I wanted to take care of those. And it became pretty clear to me that to have a reasonable chewing capability, and less importantly for cosmetic reasons, I needed full mouth restoration. I did a lot of research. Um, it's well known that treatment for full mouth restoration in the United States is very expensive and also time consuming. It can cost upwards of $50,000, and it may take up to a year or even more than a year for the entire thing to be done. So, depending on the need for bone grafting and sinus lift, these are the two technical things I had learned that is needed for full mouth restoration if I had to do it in the United States. But that was not an option for me from the cost point of view and also for the time perspective. So what I decided to see what are the alternatives available to me to get this job done. And yeah, all roads lead to Rome, and that's where it was reading. And I learned about this single-piece basal implant technology, which probably can enable an expert maxillofacial surgeon who knows the anatomy of the body very well to safely perform this procedure, and they can probably get this done in a matter of days, less than 2 weeks. That was unbelievable. I thought that maybe I'm not reading it right or something, but a lot of research I did, read a lot about it. There's some research papers I read, and then all roads lead to Rome, and it's pointing to Dr. Motiwala as the top of the list, and I wanted to pursue this solution with his team. So we had some consultations on the phone. I sent some X-rays. He even talked to me on the phone at length once, and then explained to me, and I kind of got assurance, reassured myself that this maybe I'm on to something, and I can get this done here. So I decided to take a leap of faith and come to India. India is my home country. I originally hail from here, though I have settled for the last 30 years in the United States. But what was holding me back was that this method of basal implants is not approved by the American Dental Association. So I needed to find out, is it science-based? Is it something that, that can be safely done? Is there a history of successful implementation? I came across some research papers. Actually, a study was done in Ahmedabad, I think. A team of doctors, they did a research on some 110 patients, and they came out with some statistics like 97% success rate and one or two implant failures, but then nothing major. So I knew that I may be on to something here I can pursue. Needed more convincing, but if you go to his website, drmotiwala.com, it's very, very informative. There are a lot of case studies with before and after pictures and actual video testimonials like I'm giving today by several past patients who came from across the globe, from United States, from UK. A dentist came from UK, then some from Australia, New Zealand. I think I saw a presentation by a rugby player from New Zealand. So it's kind of inspiring. Okay, maybe I should seriously consider this. And then I was always in constant touch with the international coordinator, Farah, who actually put together coordinated everything, and that was very helpful. Then, anyway, we were planning to come to India, and I wanted to see whether we can combine our visit with this, at least have a consultation first, and then, if necessary, and if I'm convinced, then we maybe take the plunge. That's exactly what happened. Came here to support me in my decision making. I brought my wife along, my brother and sister-in-law. We had a lengthy, productive conversation with Dr. Motiwala. He patiently explained everything. He looked at the X-rays and he said, you know, you're a good candidate for the traditional method, or you can also be a good candidate for the basal implant technology, single piece basal implant technology. There's nothing, it's your choice. And here, what I liked about the doctor's recommendation was that he said, you have most of the teeth have to go away, but there are 6 in the lower jaw that you can probably retain. That they'll look good to me. And I really liked about that, the suggestion and recommendation he gave. And even on the day of the surgery, we decided to go with him. On the day of the surgery, before starting everything, before giving me the anesthetic, he said, do you want to reconsider this 60th retention? I'm on the fence. It's up to you. Totally your decision. And he said, looking at your body language, I think you want to retain it. So let's keep it. I like that approach. So he's a very practical, very gentle, and the whole team actually is very, very, I'm a quality professional. I have implemented ISO 9000, help companies implement ISO 9000. I see systems all around this place here. There are assignment of duties, people know exactly what they're doing, and he's like an orchestrator. He makes sure that everybody understands their role and they perform to the best of their ability. And always, his all-seeing eyes are always there, taking care of everything. So I may be speaking a lot here. I don't know, it may be a little boring for some people, but I just wanted to say what I wanted to say. So after that, I took the plunge. We decided, picked on a date. I came here on the 26th of January for the procedure. Started about noon. I was prepared to stay here for 6 hours, and then at 4.5 hours he said, I was relieved to listen to him, and he said, you've been a good patient, you cooperated very well, so we finished in 4.5 hours. I really like that. Then I was given a painkiller. It was not painful, it was very tolerable because he is very gentle and gave a local anesthesia and all that. Everything went very well, apparently. And I went back in the night. They were kind enough to send a male nurse to my home at 10 o'clock in the night to give the second shot. He said, it's given so gently, I did not even know when it was given to me. So after 3 days, I was brought back here for the trial. There was minor adjustments needed. The next day, I was again asked to come, and everything was fixed. And within a week, I had a brand new smile and brand new teeth. Little bit of pain here and there, nothing that cannot be resolved using some over-the-counter pain medications. But here I am. Look at my smile. Can you see? Yeah, that's how it is. This is the result, and probably they will put together this video and then put a past picture of mine. Maybe you can compare. Yeah. So the whole procedure was in sharp contrast with the very expensive and time-consuming traditional methods, the practice in USA. I got quotes from 3 very reputed implantologists, and they all said upwards of 50,000, but more importantly, more than a year and a half to implement, and that was not a solution for me. So one of them said, this technology is not approved in the United States. further independent research, and I reviewed some case studies on his very informative website. And talk. I also had a chance to talk to two of his patients now who had previously got the job done here, and it was very, very inspiring to listen to them. One had got it done about 10 years ago and still looking good for him, and another had got it done 3 years ago, and he was also very, very encouraging that I pursue this procedure for myself. So the next thing was actually come to Hyderabad and meet doctor. As I said, I met him with my wife and my brother and family, and we instantly knew that we were on the right track and I should get this done here. So we set up everything. 26th January was the date fixed for that. 3 days later, I got my permanent teeth, and I had subsequently a couple of reviews, and today I'm here. I'm pretty satisfied with the outcome, and I have a brand new smile, and I'm quite happy, and I have no hesitation in recommending Dr. Motiwala and his super team here who have done a fantastic job. There may be hundreds of implantologists all over the city and in this country. It's practiced extensively, but you need to have faith in the surgeon and his team that they are capable and they can deliver what they promise, and that is the confidence I had. And I had no hesitation going through this procedure here, and I'm really happy about it, that I took the right decision. The whole family is happy about it, and I'm going back very satisfied. And follow-up instructions are very clear that I should take some 2D X-rays every 3 months and send him so that he can keep monitoring the progress, that everything is working still well for me. And also instructions on how to maintain through proper brushing techniques, then proper water pick cleaning, keep my teeth healthy. And I intend to do all those instructions to the T. Thanks for listening. I hope my presentation will help anybody in my situation who may be looking for a solution like I did. They get some inspiration to consider single plant basal implants, which are quite safe and effective, and also done in 10 days. You can't beat that. Also cost effective. So consider that by any implantologist, but if you have a preference for Hyderabad, no hesitation in recommending Dr. Motiwala and his team. Thanks for listening. So one thing I wanted to add, when I visited a year ago, I had gone to a dentist here locally known to my sister's family for normal periodic cleaning. And at that time, that doctor had suggested, why don't you consider basal implants, which can be done quickly and effectively and safely. And it did not register with me at that time. So I did not understand what basal implant technology was. I did not even do any further studies on that. But when I consulted with 3 renowned implantologists in California to see what options I have, they all came out with the traditional implant supported, full mouth restoration, but it was all time consuming. It will take minimum, it may involve bone grafting, it may also involve sinus lift, and this may take 1 year or more, 1.5 years or more to get the whole thing done. Also very expensive, $50,000 to $60,000. I mentioned to those 3 specialists whether they can do a basal implant. That's what I heard about in India. And they said, 2 of them actually said they almost sounded as if they had never heard about such a thing. And there's one surgeon who said, no, that method is not approved by the American Dental Association. It may even be banned. So we don't practice it here. Then I did further research and I was convinced that this is a safe enough method that is practiced widely in India and Europe and maybe Malaysia. So I wanted to pursue that. And today I can say that based on my personal experience, it is a safe procedure. It is effective, cost effective, and also saves a lot of time. Whole thing can be done in 10 days. I just couldn't believe it. It's a fact.